So welcome everyone to our virtual work experience by Dental Mentor UK. My name is Arnold. I'm a dentist in Preston in Lancashire. And I'm joined by Dr. Phelps and Dr. Simpkin, who are dentists that I also graduated with from the University of Central Lancashire. So they're going to be sharing their experiences, their day-to-day routines at work, challenges they face, and really letting us know as much as possible about what it's like being a dentist. So if you have any questions, you can message them in the chat. In the second half of this session, we're going to be allowing you to ask your questions. So be sure to have those ready. So we'll get straight into it with Dr. Phelps, who will be telling us a little bit about herself and telling us about what she does.
So nice to meet you all. You could call me Olivia. I feel like Dr. Phelps is very formal. So I guess I'll start from like A-level, seeing as some of you guys are potentially A-level situation at the moment. So at A-level I did biology, chemistry, French and maths. And dentistry wasn't really on my sort of horizon. I wasn't really thinking about dentistry, to be honest. So something that I did enjoy at school was doing sort of dissections and stuff like that, basically in biology. So I decided to go for a uni course in anatomy that offered sort of dissection and prosections on the course. So I ended up going to Bristol Uni and did human musculoskeletal science, which is basically human anatomy. I did that for 3 years, and luckily on that course I did a lot in terms of dissections and things like that, which in my personal statement for dentistry I use that to say, oh, manual dexterity and hand-eye coordination and all that sort of thing. Really enjoyed that course, and I got to finals and didn't really know what to do with myself, and it was actually my brother who thought of dentistry for me, because when we were small, he's 2 years younger than me, but when we were small I used to pull out his baby teeth for him and he'd ask me to do it, so he was like, oh, what about dentistry? So I ended up doing some work experience both in the UK and in France, because I've got family over in France, and I got to see the different ways that dentists are not only in the same country but abroad as well. So that was really helpful, and then because I felt like it was something that I could see myself doing, I decided to apply for it, but I'd finished university and didn't really give myself time to apply to start the dental degree straight away. So I decided to kind of give myself a year off working, and I managed to land a job as a receptionist in a dental practice that was local to my parents' house. So I moved back home for a year, which was painful. But I ended up working in this private dental practice as a receptionist, and I felt like that was possibly the most beneficial sort of work that I did before going to dental school, because going to do the work experience, shadowing the dentist, you got to see all the sort of patient interaction side of things, but how the patients interact with dentists, I'm sure these guys will agree, is quite different to how patients interact with receptionists. Receptionists are, part of the admin team that frankly you can't live without in dental practice. They do so much behind the scenes, and frankly patients, because they're anxious or sometimes not terribly nice, they can be very rude to your reception staff. So it was maybe not nice isn't the right word, but it was helpful to see that side of things for sure. Luckily the dentist that I was working for at the time was super supportive of me looking into sort of progressing into dentistry and applying for dentistry. So on the odd occasion where I was doing something interesting, his wife would cover the reception desk and I'd get to go in there and nurse for him. So I didn't really know what I was doing at the time, but he was so good. He would just do everything himself, really, and just let me watch, and patients were super relaxed about that. And it was really nice to see him interact with patients, because it's not only the sort of knowledge of dentistry and the, you know, being able to do a really good filling or really nice crown, it's also how you interact with people and how good you are at communicating with people. That's something that I found really helpful watching him do it, because he was a very smooth talker, a bit like these two. So that was really good. And then I managed to get an interview at UCLan, went for the interview there, and luckily landed, first time lucky, applying to dentistry. So that was good. 4 years of doing postgrad dentistry, and whilst a lot of our peers tend to go into dentistry undergraduate, for me doing postgrad was definitely the best thing. I felt like I had time to mature, had time to really know what I wanted. So I was one of the nerds on our course. I'm sure these guys would agree. They would call me Hermione, because I knew it's what I wanted to do, and I was always the first one to ask questions, and all my housemates were like, let's sit on the back row, and I was like, oh, I'm going to ask a question. They're like, shut up. So I loved it. Came to the end of dental school, and we went through a round of interviews to get your first year out of dental school in a training practice. So what that means is you're technically qualified at the end of dental school, but before you get released into the wider world, you do a year's training in a dental practice that has a dentist that's there to support you, and they get paid to do that through the NHS. And that was great. I landed a super great practice in Cheltenham, which was relatively local to me. And my educational supervisor was amazing. For me personally, I wanted to try and get a practice where you were learning how to get up to speed, and as you guys probably have experienced firsthand, being in a dentist chair, you feel like sometimes you're out before you're in there. It's quite quick. So yeah, getting up to speed, but without cutting corners and without patients feeling like they've been thrown out before they've come in. So my educational supervisor was really good at that. Did that for a year, and then I decided that I wanted to further my training in a hospital setting, which is what Arnold was mentioning. So I decided something that I really enjoyed doing is taking teeth out, and sometimes teeth can be very difficult to remove. So doing a little bit of minor oral surgery, so making a little cut in the gum next to the tooth and removing bone and dividing teeth up into smaller pieces to be able to remove them, is something in dentistry that we should be able to provide in like a normal dental practice. But a lot of dentists understandably don't feel very confident about doing that. And it's something that I didn't have too much experience with, but it's something that I loved doing when I did do it. So my educational supervisor, so the dentist that was supporting me in my first year in practice, kind of said, Olivia, you should definitely apply for hospital and see if you manage to get a place and do a bit of oral surgery, which is what I did. And again, I was lucky enough to get my first choice in terms of hospital placement for that. So I ended up working in a hospital in Swindon, the Great Western Hospital. And in that environment, it's very much working as a team. So you are supported not only by the nursing staff, but other dentists, and it's a really lovely environment to work in. And I think maybe I almost prefer it to working in general dental practice, just because of that level of support that's there. And if you want to ask someone for an opinion, or you want to ask someone to pop in and give you a hand, or how they would tackle a case that you're not too sure about, it was just there and super easy to do. So that was really helpful. I really loved that, and came towards the end of it and I was gutted to leave, really, because it's a 12-month placement that you get in hospital. You then have to reapply if you want to continue. So then after I finished my year, I decided that I wanted to go back out into general practice, because I think long term I see myself in general dental practice, and I didn't want to leave it too long before immersing myself back in, because it's very different work. I hadn't done a filling for just over a year, hadn't done a root canal in just over a year, and there is an element of dentists de-skilling without doing that sort of work for some time. So I ended up going back out into practice, and I'd been working in practice for 6 months, and then coronavirus happened and life has been a bit different since then. But in terms of what I've learned from sort of work experience, I would say the importance of working as a team, which I'm sure you guys already know. It's different, as I say, between working in hospital and working in practice. In practice, you are working within a team, but ultimately the work that you're doing falls on you. It's you, the patient, and your nurse, but obviously there's a lot of work that goes on behind the scenes from reception as well. In hospital, it's everyone in the department is happy to help, as well as other dentists, consultants, oral surgeons. But definitely working as a team is very important. So if you can integrate that into your personal statements when you're applying, anything you're doing, like sports, any sort of job that involves other people, is definitely really important to mention on personal statements and things like that. The other really important factor is how you communicate with people, because you could be the worst dentist, like you could do a shocking filling, but if the patient feels like you've taken the time to speak to them, to reassure them, make them feel better, they will think you are amazing. If you can't really speak to people, then you will struggle with dentistry. It's definitely one of the things that was stressed at university for us, and we were kind of in a privileged position where there was only 30-ish people on our course, 31 people on our course. So, you know, we got a really, I feel, personalised experience of dental school, and our sort of lecturers were they emphasised good communication quite heavily. So definitely, if you have any sort of job that is public facing, definitely worth mentioning that on your personal statement. But I would say, as a roundup, dentistry is a career where it's not people's favourite places to go. So if you are confident enough to try and change people's opinions of dentistry and make them feel better about not only dentistry but themselves, and you're willing to put the work in and take the time with patients, then I think you'll be really happy in dentistry. So yeah, that's it.
Thank you for that, Olivia. Olivia was one of the top students at dental school. So later on, when we're asking questions, you can ask her the harder ones. We'll let her take those ones.
Nice one.
Okay, so we'll jump straight into having Jake talk about his experiences.
Hello. Yeah, just call me Jake. I, unlike Olivia, I actually always wanted to be a dentist. I just wasn't very studious when I was younger. So I picked my subjects around, my A-level subjects around dentistry, but then didn't really apply myself with the chemistry because I didn't like it. So then I went on to undergraduate, where I did it was meant to be biomed, but I got forgotten, so I ended up doing biological science, which was still fine. I could still use that, and it meant I didn't have to do some of the more boring subjects. And then because I'd messed up my chemistry, I thought I would go back and do a teaching course. So I went and did a PGC in secondary school science teaching, which was eye-opening. And then I still had to go back and redo an A-level. I thought I could get away with that, but I had to go back to college and redo my chemistry A-level. And then I went to dental school. I don't know if you've watched any of Arnold's other videos. I only applied to UCLan. I don't recommend only applying to one place, but I kind of like the failure not being an option approach. So that's how I did it. At UCLan, worked with Olivia and Arnold, amongst others. I felt it was a good course. It was really hands-on, which for me, I'm not as academic as some of my colleagues and things. I think that Arnold and Olivia would say that I liked the patient side of it and the hands-on side, and kind of learned from watching and asking. I'm not a very big textbooky person. After UCLan, I went and did an FD year, like Olivia said. What Olivia didn't say is you can get a job straight afterwards, but only in private practice. And if I'm really honest, because I work in a private practice, the chances of you getting a job without doing that foundation year are pretty much zero. Your private patients often pay a lot more money and expect a bit more. So if you've got no experience, you're not likely to get a job. FD practice advice, get a mixed practice if you can, somewhere that does a good split between private and NHS, so you can learn a little bit from both sides, and maybe somewhere where somebody there is doing like a specialist interest, or so it could be root canal treatments is something that practice provides, or oral surgery or implants, so you can learn something. So I've always been interested in implants and surgery, so my foundation practice, there's a gentleman there doing that. I think that's worth trying to do if you can. And then after that, Olivia went to hospital. I was a bit unsure. I love surgery. I'm actually in the middle of applying to do a master's in oral surgery, but I'm a bit older than Olivia. So I wanted to go and get some pennies, basically. So I ended up doing 3 days NHS work, a very big NHS practice. I was given that job by one of our lecturers, and I do 2 days a week private practice. I got that job from another one of our lecturers, and then I do some emergency dental work, so kind of evenings and weekends, providing dental care, predominantly for those that don't have dentists. And then on the back of that, I got into dental auditing, which I never thought I would do. So checking people's notes are up to scratch, and giving feedback as and when they need it. And like I just said, I'm wanting to go and do a master's in oral surgery and try and do some hospital-based work there. That would my advice. I mean, I like that. I like kind of variety. It stops things getting boring. Going forward, I'd like to do a bit of teaching as well, a bit of dental kind of clinical teaching. I think Olivia hit it on the head. Communication's your biggest thing. So all the different places that I work, most of the patients are nervous, so making someone feel like you actually care, and actually caring helps. I do care, and I really like trying to change people's mindsets. It's like a big achievement if they're not scared of coming in anymore. That's, they want the help and they bring their family. I like that. And there's practice. I remember us all going to Carlisle on a train, and one of our colleagues kind of pointing out that you just start conversations with people. I do. It's a good way of, you don't know who you're going to meet when you're at work and what the patients are going to do. So if I'm ever out and about, I always start a conversation with a random person. It doesn't always work out, but you can practice talking that way. I don't know where you're all up to. I can't see everyone's faces. But I know one of you is waiting for postgraduate. If you've not already done jobs, I think a job that's really good, and I guess there's quite a lot of it around, would be some sort of care job. Working in a care home or something like that, because you're face to face with people, like Olivia said. you're obviously in a position of responsibility and trust, which you would be as a dentist, and it shows that you're a caring person. I didn't do that, but in hindsight, I think that would be a really good thing to have done. Yeah, I think that'd be my main job. I think that it's kind of accessible to people that would kind of be relevant. Work experience wise, at the moment it's tough, but hopefully later on when you ask us some questions, it will help. But again, I just ask your own dentist. What about a nursery? Am I allowed to answer these questions, Arnold, as they come up? I can't hear him. Yeah,
We'll answer them at the end.
Oh, at the end. Okay. Sorry. Yeah, anything. It doesn't have to be a care work. I just one that kind of ticks all the boxes. I did a million jobs. I've had about 15 jobs. I'm just trying to pick one that kind of gets all the boxes in one for you. I don't know what else to say, really.
I think what would be good is tell us what a typical patient journey is like at emergencies or at the private practice or at the NHS practice. You know, when a patient steps in, what's happening with that patient?
Okay, yeah, okay, fine. So I think the NHS one will be a good one to start with because the journeys are often bigger or more involved, and probably something you'll see more of when you're doing your training and even when you first graduate. So a bit of background, the NHS practice I work at's in the centre of Blackpool. It's a really deprived area. So a lot of my new patients are in high dental need, I should say. So they've neglected their oral health quite a lot. So the typical patient journey, appointment one, they come in, they meet me for the first time, they're often a bit nervous. I try and do an examination, so just a general overview of their oral health, including decay, the status of their gums and the bones supporting their teeth, which will include a couple of x-rays, the type of which would depend on what I'm thinking of doing with the individuals, feeding that back to them and coming up with a bit of a plan. And I always like to drop in a little bit of advice each appointment, trying to build up a big kind of story at the end, because I don't want to put people off. So it's usually just start with just try and reduce your sugar intake would be an example, and give it a couple of things which they might not be aware of. And then the plan typically is kind of multi-layered. So you'll learn that when you go through dental school, but like Olivia and Arnold, we kind of are all taught the same. Kind of start with the fundamentals, so getting people out of pain has got to be number one. So that's often achieved through root canal treatment or extractions. Once they're out of pain, kind of look at the foundation of the teeth, so that's your gum and your bone, which is a bit more education, smoking cessation. And then you start to try and fix what you can fix, so fillings, root canals. And then once you've got that and they're on board, you can look at providing either dentures or crowns, bridges, whichever's more appropriate. So that can take, it can take weeks depending on how severe it is, or it can take months. But that's really not unusual at all for the NHS place to go from a bit of a neglected dentition whereby people might not want to go out and smile, to at the end where obviously they can by whatever means necessary. Usually it's with dentures, if I'm being honest, where I work. I treat a lot of addicts or ex-addicts who are looking to try and better themselves, and that's really rewarding. They're some of the most grateful patients, but that's a lot of extractions, so getting good at your extractions like Olivia said, or even in the case of one lady that I sent, she's having 20 odd teeth out, so I sent her to the hospital to have them all out at once. Thought it'd be a bit nicer for her, more time effective for myself as well as. So yeah, I think that's a typical for me, where I work, that's a typical NHS journey. It's quite all embodying. You kind of touching on all aspects of your dental teaching, if you would, or learning, to deliver the whole package. My private patient journey, is often less severe. Often those people are more aware of their oral health, not all the time, but most of the time, and are wanting to either improve on what they've got. So that might be simply replacing some metal fillings with some white fillings. Old crown and bridge work they want replacing with new crown and bridge work, tooth whitening, tooth straightening, so some simple orthodontics, right through to the gentleman who employs me. He does a lot of implant work, and so to that, it's often more chunked. So the patient will come for a particular thing, or they'll have in their mind, I want to change the shape of this one, please, or can we go a bit whiter, or it's a bit less of a full journey, a bit more of a chunk. The emergency work, 90% of that is extraction based. So on a pre-COVID, a typical evening would be 6 till 9 o'clock. I'd see 10 patients. Of the 10, 9 would be extractions that I'd do there and then. 1 would often be either antibiotics or referral. It's very unusual that I'll have done 10 extractions on 10 patients, but that's most of what it is. Most
Where do
of those
patients come from, Jake? The emergency patients?
Oh, okay. It's quite a big catchment area, actually, including Preston, Ormskirk, but it's predominantly Blackpool because we're in the middle. But it's actually at the centre where Olivia and Arnold, with myself, went to do our clinical training.
And
so predominantly
how
Blackpool.
With your services, the emergency dental services?
Yeah, that's it.
How do they get in touch with the?
There is a number. There's a dedicated number, but often they're given that through 111. So if they phone 111, they're often diverted on or given a number to call. You're triaged by boys and girls, lay people, and then popped into the clinics. At the moment, they've changed the triaging, so they have a dentist doing that as well as at the moment to try and sift out those that actually need to be seen that day versus some that could be treated elsewhere or differently.
Yeah.
So again, it depends on where you're working, but I agree with Olivia. Getting confident with extractions and the possibility of having to do an unplanned surgical extraction would be really beneficial in, especially where I'm working, but in general dentistry. You don't want to. So sometimes you look at a tooth on an X-ray or in the mouth and you think, oh, that won't be a problem, I'll take that out in a couple of minutes. But no, for whatever reason, it doesn't work. Olivia's pulling the face, it's happened to her. For whatever reason, it just doesn't. You don't really know why, and you end up in a bit of a mess. And it's always good to have your get out of jail free card. So if you feel confident enough to be able to cut the gum, as Olivia said, get rid of a little bit of bone so you can see more of the tooth and grab a bit more of the tooth and pop it back together again, that goes a long way, especially if you're on your own. Because one day a week I'm completely on my own at the private practice, and this actually happened to me. I got stuck. I knew from the outset it was going to be difficult, but I had to do a surgical removal of an upper 7 on a very nervous lady. So having some overview and idea of what to do is definitely worth doing.
Would you say part of the job is anticipating and being able to resolve things when they come up unexpectedly? That's
most of the job. I think a lot of the job is kind of like learning to drive and then actually driving, but then timesing that by 10. So you obviously you're taught the basics on how things should be, but in reality, you often find patients' wants, needs, and what you're working with. It isn't textbook, so you're kind of coming up with things on the spot. And I guess as you do more, your little box of tricks gets bigger. The things that work with you, whether it be the materials or the way you approach the patient in the first place, and then I guess anticipating that. So when you look at the patient for the first time and you get their X-rays and you get an idea of what you want to do, trying to think of contingencies in case things don't quite go to plan is a good idea. Yeah.
Thanks for that, Jake.